What does it mean to you to thrive with an MPN?
I think living with an MPN can be very difficult. I think there's a number of things. First of all, there's always the worry of what's going to happen in the future. Many of these MPNs can start as fairly, for lack of better terms, benign issues and can convert to something much more serious. So I think living with that sort of time bomb in the back can be extremely stressful. So figuring out how to live with the fact that there is some degree of uncertainty. I think the other thing is making sure to understand your disease. These are very rare disorders. And even if you go to a hematologist, oncologist, specialist, a lot of times they don't have all the information because they don't see a lot of them every year. So it's really important to make sure that above and beyond that, you understand what's going on in your body so that when new things happen, new symptoms happen, you're able to really address them as opposed to sort of living with something that may make you feel poorly that's not being addressed. So again, I think the biggest piece of this is saying, how do you live with uncertainty and how do you make sure you understand your disease well enough that you know that what's going on in your own body?
Patients can sometimes feel like they're bothering their healthcare team with their comments and questions. Why do you think it's important for patients to speak up when it comes to symptoms and side effects?
Well, there's a lot of things. This is a disease, again, that we can direct our therapy many times towards symptoms. And so when we think about how do I direct my therapy, so how do I treat somebody, symptoms are an incredibly important part of it. And there's nothing worse than having a patient come and see me who I see every 6 months because they've been pretty stable, and be like, oh, for 3 months, I've been feeling awful. And you're like, well, why didn't you let me know? We could do something about this. So if there's something that doesn't feel right, it's very, very important to talk to your healthcare provider. I would much rather be bothered and handle something earlier on than miss something and really have a lot more catch up to do afterwards. The other thing is symptoms that may indicate a blood clotting event. We know that patients have a higher risk of blood clotting. These are extremely important to identify early on because if they go unchecked, they can cause more damage.
Dr. Palmer, as we close out this conversation, I wanted to get your thoughts on where we stand with progress in helping people live longer and truly thrive with MPNs. What would you like to leave the audience with?
So I think that the first thing is make sure you understand your disease. Don't hesitate to ask for a second opinion. It's always good to make sure you talk to someone who can really explain so you feel like when you go home, you understand what's going on in your body. Make sure you understand what symptoms to look for, what things to be aware of, because a lot of times people come in and they have no idea that, these symptoms are actually related to their disease. The other thing to make sure is that you're very honest with your provider on how you're feeling. A lot of times people come in and they say, oh, how are you feeling? I feel fine. But then I start to ask very specific questions and they're like, oh yeah, I'm really tired. My fatigue is 8 out of 10 or something. So make sure you're really honest with your provider. When they ask you how they're doing, this is not a social visit. This is a visit where they need to know your symptoms. So you don't need to say I'm fine like you normally would if you were walking down the street. This next thing is to always make sure to know where there's clinical trials because we are making enormous, great leaps and bounds in this field. It's a really exciting time for myeloproliferative diseases, and there's a number of new drugs that are being tested and coming out. So it's always important if the opportunity is available and you can do it, clinical trials are a great way to get treatment. Plus, you're giving back because these are things that help us learn whether something works or not. So even you're not as much a guinea pig, you never get a sugar pill. Like it's one of those things where you will always get the treatment you need, and then they may add something to it, or you may be in a situation where there is no treatment, so they try something. But it's really, clinical trials, I have to emphasize, are a great way to get therapy, and really are how we know everything that we know a lot, about treatment for these diseases.
Yeah. Sounds like there's a lot of progress and hope in the field.
Oh, absolutely.